So another feature of our units are the lights. If you see, there is no light on this unit. So the light is we generally design from the seats. In our units, we don't have the armrest. So I'm sure you will be surprised as to how a dentist could work without a spittoon unit. It's foldable with the leg rest, and it is basically used for geriatric and pediatric.
Hi viewers, this is Dr. Prince. Welcome to your channel Dental Treasures, the prime info destination for dental community. So today is the first video where I'm going to introduce a dental equipment. To make this video special, let me introduce the most advanced dental units I have ever come across. So dental chairs are a very important component of a dental practice. Having a right dental chair is important because it can affect your productivity, the comfort, and above all, it can give you a hassle-free practice. The company that I'm going to introduce today is called Airel from France. It is established in the year 1921. It is a very popular dental chair among all the dentists all over the world. The chair has got many features and it makes it a popular choice among the dentists. So today let me introduce Dr. Noor Pasha, MD of Airel Company India Limited. Hello doctor.
Hello.
Welcome to the show.
Thank you. Thank you, Prince, and I really appreciate you giving us an opportunity to take part in your YouTube channel and introducing our company as one of the best leading companies in manufacturers of dental chairs. And I thank you for giving us an opportunity in this project of yours.
So, doctor, can you give me a brief glimpse about your company?
Yeah, Airel is basically a French company which was set up in 1921 in France, and in India we collaborated with the French company in 2006, and we started the manufacturing unit in Bangalore.
So doctor, what is the most important feature a dentist should consider while choosing a dental chair?
Most important feature a dentist should consider is basically they should have the comfort, the design, and the ergonomics. Ergonomics is very important for a dentist while choosing the dental unit because it is related to the dentist's health and hygiene. So when the dentist is using a dental unit, he should be very comfortable so that it doesn't affect their back pain, neck pain, and strain their eyes. That is the basic areas where a dentist generally gets affected, and stress and strain which causes the back pain, the neck pain, and the stress to the eye and damages these particular areas of the body. So to avoid all this, I think a dentist should look into these points firstly, and secondly it is the hygiene, which is very important in today's world because of the many infections, disease which are contamination due to the water, due to the surface contamination. So I think these are very important points which the dentist should consider in today's world.
Doctor, what are your thoughts on ergonomics and how do they relate it to dental chairs?
See, ergonomics is basically the positioning of the dentist, basically the doctor. So it is the sitting position and the standing position, which is very, very important in today's world, well, especially for a dentist, because while working position is not okay, then it affects their neck and the back. So most of the dentists land up with a neck pain and a back pain. So to avoid this, we have designed our dental units based on considering the ergonomics of the dentist. So the dental chair can be used both for the right and the left-handed dentist, and the space occupied is very less. It is a small, and the entry and the exit of the dentist and the patient is easily accessible.
How does a dental chair protect patients from infections and other health hazards?
Airel dental units are designed specifically to protect the patient's health. So we have a special system called the IGN, which is integrated in the dental unit. So this system forms a biofilm which prevents the bacteria from growing on the dental tubes, all these water lines, and prevents the contamination of the dental tubes and water lines. So this especially is needed in countries like India, where there is no purification of water is done. So this is one of the very important factor which we consider in our dental units to protect the patients from any source of infection.
So what are the different models of dental chair available for purchase?
The three models available in Airel are the K2 version, the P8 and the P9 version. The K2 is the foldable seat, which is basically more comfortable for the geriatric and the pediatric patients. It allows easy entry and easy exit for the patient, and it occupies less space in the dental clinic for the dentist, and also it is very customizable based on the dentist requirement. And P8 is an ambidextrous chair again here, where both right and left-handed dentists can work very easily, and it has a narrow backrest version, so it helps in easy access, light access, and visibility is improved because of the narrowing of the backrest. And we have the third version, which is the P9 version, which is more compact, sleek, and again right and left dentistry can be practiced in P9 also, but it is a latest design, the newest version of Airel, and it has more modifications and the latest technologies which have been adopted in this unit.
Doctor, what do you think about the new dental chair technology, and what are the key features of your dental chair?
The key features are well-being, integrated and automated. Well-being is the well-being of the patient and the dentist. So that is basically to maintain the health of the dentist related to the health issues which are caused at the end of the day for the dentist after the long working hours, the standing and the sitting positions. We advise the dentist to use the 7 o'clock or 17 o'clock position, which is very comfortable in our units. And integrated is basically the water units and the suction units, which are segregated and easy accessibility for the dentist also. Automated, our units are totally automatic. So I would like to take you through the demo of the dental unit. This K2 dental unit is a cantilever model, and based on it is totally mounted on a pillar. It is a baseless model, and if you see the backrest, it has a wide curved backrest which is made up of aluminum, and the headrest is a double articulated pneumatic headrest which can be adjusted according to the patient's convenience. The K2 seat is a foldable chair where the seat is foldable at the leg rest, and it is basically used for geriatric and pediatric patients. So that is, it occupies less space and it is very comfortable. If you see the upholstery, it is smooth, it comes in different colors, and it is easily cleanable and maintained for many years. If you see, even after 5 years, the upholstery remains the same without any issues. Next, the working element, which is a very important element for the dentist to operate on. So the working element is one of the features of Airel, which is the touchscreen model. So we have the different features, which is up, down and back front movements, and different chair positioning which can be saved by the dentist. If it has a USB and a card, so each dentist who uses this unit can store his features based on his requirement. So the next time when they reuse this unit, their features will be reflecting on the unit. It has a protected password, so each card actually is just like a small card which is used by the dentist. So once it is inserted, all the features are reflected on the screen. So this is one of the features of the Airel dental chairs. So next is the elements, the turbines, which are electromagnetic, and they are very flexible, if you see, and they are very light and easy to use by the dentist. Generally, the dentist land up with the shoulder pain and the arm pain after using the elements. But this is so light that the dentist will never feel the pain on their arms and the shoulders. So that this is why Airel has a very important plays a very important role in design of the dental unit for the dentist. We also have another feature called the disinfection system, where after every use of the turbines and the handpieces, generally during a surgical procedure, generally we send the patient back and ask them to come back probably the next day or evening because it needs to be autoclaved. But one of the features of our Calbanium, which is integrated in this unit, is the Calbanium, where you place the handpiece inside after doing a surgical procedure, and you see within 2 seconds there are fumes which come out which cleanse the handpiece, and it is ready for use by the time the chair is cleaned for the next patient. That is one of the features of this unit. So the dentists don't need to waste their time for calling the next surgical procedure. It can be done back to back without any disturbances. Also, the tubings are all food grade tubings and the medical grade tubings which are used in our dental units, so it's easy to clean. And as I have already explained, the hygiene system, which consists of the Calbanium, which is a special feature of this unit, which cleanses the entire tubing of the dental unit and provides a thin biofilm which prevents the bacteria and algae from forming inside the tubing, and that is the main source of contamination for the dentist and for the patient. So that is the main thing which generally in today's world no one wants to focus on this. Everyone wants a good dental economical and hygienic and best dental chair, but I think Airel is the only chair manufacturer who caters to the hygiene of the patient and the dentist. Next, I would be explaining about the suction, where we have the low vac suction and the high vac suction. This is basically used in the mouth of the patient to drain out all the blood and the saliva and everything. And one of the features of Airel units is suppression of the spittoon unit. So I'm sure you will be surprised as to how a dentist could work without a spittoon unit, but it is very easy. It is the mindset which the doctor can create in his environment with the patient and train the patient psychologically as to what is the disadvantage of having a suction, because cleaning is one of the hygiene is related issues, blood contamination and aesthetics, which looks very bad, where you can see all the blood and the saliva flowing everywhere, which is not a very good sight for the patient. Generally patients get scared seeing the blood also. So when you are using the dental suction, so that the patient is more comfortable for the treatment, and you can save time in the treatment. Basically, each time the patient spits in the spittoon, you lose, if you don't, basically the dentists don't realize they lose almost around 5 to 10 minutes in the treatment procedure. In that same time, you can accommodate another patient of yours and make more money. That's the basic concept of suppressing the spittoon. And we have supplied dental units in Bangalore, in India, without the spittoon, and that practice has been going on for almost 7 years by many of the dentists in India. So we can say it is a success. So it is the mindset where the doctors need to incorporate into their dental chairs. Next, I would like you to show the arms, which are very sleek and very slender, if you see, and the paint is finished, polished, shiny finish, which we focus on the medical grade painting system here. And we also, if you can notice, in our units we don't have the armrest. So the armrest is one area which is a main source for contamination both for the dentist and for the patient. So generally patients, after spitting, they try to touch the armrest to hold it to feel more comfortable, but that is the wrong concept, because this is a main source for contamination for both the dentist and for the patient. You see the blood stains and the saliva stains, which is all generally there after the patient leaves from the dental unit after the treatment. So because of the absence of the arm here, so it's easy for the patient to enter inside and move out, and cleaning is very easy on this unit. Also, another feature of our units are the lights. If you see, there is no light on this unit. So the light is, we generally design from the ceiling. So that is very important for a dental clinic because it occupies less space and there are less arms. You can see more, the patient is more comfortable to see more machinery, to get scared and panic with the treatment procedure already. So, and also our dental units are generally customizable based on the requirement of the dentist. So based on the place constraint, also we have different models which can be accommodated. Basically, you see in Mumbai, the space is very less. So in these places, we generally advise small dental units which are very compact, and one of the units which are more compact are the K2 versions, which the doctor can be using it very comfortably with less space, and they don't need to think about, okay, we don't have much space, how do we accommodate the big chairs? So we have the option wide open for both these small places and the big areas also.
How frequently maintenance checks should be carried out on your dental chair?
So the maintenance checks for our units is generally between 6 months to 1 year, but it is very minimal after sales service. So, but also it is very conveniently designed, our units, when the service engineer comes in to a dental clinic where our units are available. So it's very easily accessible for the engineer to open up the cabinet there and do the service even while the doctor is working on the patient. So the working need not be disturbed. A doctor can continue to work and the engineer can complete the servicing and he can finish the job without any inconvenience to both the dentist and the patient.
So how do you compare your chairs with that of the traditional chairs available in the market?
If you see, Airel dental units are fully automatic dental units. We don't believe in the hydraulic or semi-automatic units, because today if you see the generation and the technology advancement, we manufacture and totally are into the automatic versions. So we don't believe in the hydraulic systems. So our units are basically pneumatic. We have the pneumatic suction and the automatic version.
So what makes your chair unique compared to that of the other chairs?
The Airel units, basically you can say the unique feature is the ambidextrous version, and I will take you through the highest version of our models, that is the PE9, which is the latest and the latest with the upgraded and latest technology, which I can display in the next unit. This is the PE9 dental unit. So the PE9 dental unit is basically designed for the comfort and the ambidextrous version for both the dentist and for the patient. If you see the design of PE9, if you see the backrest is quite broad and made up of aluminum. So the wide rest broad is basically to suppress the hand rest, as I had explained earlier. So when the patient sits, based on the French technology, if you rest your hands on the backrest, the patient is more in a relaxed position. So this helps the doctor to work on the patient in a better way. And even the local anesthesia which is given in the oral cavity, this acts better, the patient is more relaxed and the treatment procedure goes on in a relaxed position. So same thing, that is the reason why we suppress the armrest. So I think this would explain the whole concept of suppressing the armrest. It is totally advanced technology in this unit, and it is an ambidextrous version. Ambidextrous is basically used for both right and left-handed dentist. So in this, if you see, you can use on a right hand, a dentist who is right-handed can use it in the right hand, and if it is a left-handed dentist, then we can, if you see, I can shift the whole console to the right, left. So the left-handed dentist can use the unit comfortably. As we have seen, Airel has 3 different units. One is the cantilever and 2 with the base, and the ambidextrous version of the chairs. I would like to thank Dental Treasures for giving Airel an opportunity to introduce our dental units and explain about the dental products and the advanced technologies on their YouTube channel.
So what do you think about these dental chairs? Are you planning to buy this for your clinic? Do let us know in the comments. So if you want to know more details about the pricing, the installation and so on, all the contact details are given in the description. Please do check it out. If you like these kind of videos, please do share with your friends and like and subscribe the channel. I'll see you in the next episode. Signing off, Dr. Prince.